You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, he says your smile is never too far gone. Your teeth are never too bad to have the smile you've always wanted. We're talking about full mouth, as he calls it, reconstruction, rebuilding mouths. With us, we have an expert on this topic. He is Virginia's dentist, Dr. Laviola. Dr. Laviola, welcome to the program.
Pleasure to be here.
So you brought a lot of photos, so we'll get to as many of those as possible. But for people that don't know your practice, who's the typical patient and what are the different procedures or services you offer?
Well, we do have a family practice, and we do everything from bondings, fillings, bleaching, anywhere up to veneers, crowns. We like to think of ourselves as a total solution provider.
What does that mean?
That means that we do everything under one roof. We do root canals, bone grafting, implants. People come in with dentures and don't want dentures anymore, so we give them a fixed set of teeth. People come in with smiles they don't like. We do limited orthodontics to correct tooth position. So a little bit of everything, but we like to keep it all in one area to make it convenient for the patient.
All right, and we're talking about these full mouth makeovers, like I think you call it full mouth reconstruction. What is that?
Yes.
Let's have a working definition of that.
It could be really anything. It could be somebody who needs a combination of possibly building the bone back up for a couple implants and then some veneers and crowns, and managing their bite to make sure, because that's important, to make sure that their teeth come together at the same time so they don't have any discomfort in their muscles. It could be pretty much anything to give them their smile back and give them their confidence back.
Now, one of the things we said at the top of the show, that your smile could never be too far gone. Your teeth could never be too bad to have a great smile. You believe that?
I totally 100% believe that. It can never be too far gone, and I'm going to show you some photos that will definitely illustrate that and blow your mind.
Okay, good. All right. Now, you've been a dentist since you're like 15 years old, it seems like. Is that right?
Kind of, yeah. My father was a dentist, and in high school I did work in the office.
So you worked in the office?
I did. I did some assisting, did some administrative work, and I always liked it, but wasn't certain that I wanted to go into that field, and then made the decision a little bit later. And ever since I made the decision, it's been the best decision that I've ever made. Because
you say you're changing people's lives.
Absolutely.
By just fixing their teeth. Absolutely,
we're changing people's lives. And one afternoon, somebody who has teeth that are uncomfortable, that they're unhappy with, can walk out with a smile that they're completely comfortable and confident, and 100% changed their life.
Okay, good. And we should mention, you called yourself a continuing education junkie. What does that mean?
Yeah, so that means that I can't get enough of CE courses. So
continuing education.
Continuing education.
Is there that much to it?
There is. There really is, especially in some of the surgical fields. The science is always changing, and if you're not up to date with it, then you're behind. And
okay.
So the day I stopped going to school and being a student, it's the day I'm done.
So you have this concept of same-day dentistry, doing everything under one roof. Can it really be done in the same day? Like people with pretty bad teeth?
Absolutely. I mean, of course, there is, big pre-op appointments, but as far as the dentistry goes, especially with sedation, I am IV certified. And there's, I believe, less than 5% of people of dentists are certified for IV sedation, can walk in. And that's one of the reasons why people come in for sedation. Not only just discomfort or fear, it's I want to get this done quickly. So somebody's busy, they're in business, they need to get it done quickly, and IV sedation gives us a tool. Not only is it faster for me, but it's also safer too.
So with the people that are getting IV sedation, you say things like they could be there 2, 3, 4 hours doing like a year's worth of dentistry.
Sometimes even 6
visit.
hours.
Is that right?
Yeah, sometimes.
And then to them it doesn't seem like it's very long?
To them, essentially, that you kind of have a loss of concept of time, which is pretty incredible. In fact, I had a patient last week, and we did a variety of procedures, crowns, some extractions, some surgery. And when she came in, I asked her, I said, what was your experience like? Because I always ask that question. And she said, I really didn't remember anything. I came in, and I left, and I woke up at home, and that's all she thought. That's all she could remember.
Now you brought some photos. What are we looking at?
All right, take a look at this woman here. She came in and she said, "Doc, I need your help. And I don't like my smile. I've got a lot of problems." And specifically what she didn't like was her teeth were crooked. She didn't like the shape of her teeth. She had some issues with her bite. She had some discomfort in her jaw because of her bite. So let me show you what we did.
All right, all right.
We moved her teeth a little bit with some trays. We gave her some porcelain veneers and some crowns to correct the aesthetics and the bite, and that's the result. And when she came in, I had to force her to smile to look and see what it was that we were working with. And
So they're ashamed to smile, even to you, and you're a dentist?
absolutely. And it's not that she has a horrible smile, but she was...
It bothered her.
She was not confident. And I'll talk to you a little bit about her husband in a second.
Okay.
Yeah.
So she brought in her husband after you did this?
Yes, she
Okay.
did. Yes, she did. But on the way out, my front desk said that the whole time she had a big grin on her face, and it was a natural smile. So this is where I get a lot of joy to see somebody walk out and change their life. This is her husband. Okay. He came in on a referral base from his wife. It's almost as he didn't know how to smile. And in addition to that, what brought him in was broken teeth and discomfort. He was in pain. And so his wife dragged him in.
Okay.
And,
Does that happen a lot with guys, right? We put it off?
It does. We do. So typically the men tend to put it off more until it gets to the point of this hurts so bad, or this tooth broke off. And
So he comes in, what does he say? Because he's obviously not even showing teeth. There's 2 teeth showing.
So he comes in and he says, "Doc, this area is killing me." He had a prior dentist, by the way, that happened to be out of town.
Okay.
And I said, "Well, let me go ahead and help you." So we did something temporarily that day, and then we had him come in to basically set him up for a full mouth rehab to fix his teeth, give him teeth back that he could chew, he could eat, he could smile, and that's the first stage result.
That's very nice.
That's the first stage result, and this is where it gets really interesting. I had both patients back in together, and I asked Ken. I said,
Husband and wife.
Husband and wife. I said, "Ken, how's Chris doing? How's Christine doing?" And he said, "She's doing fantastic. Before you worked on her, she did this. She covered her mouth. She didn't smile as much. She wasn't as confident. And she's a very successful businesswoman. And after we got through with treatment, completely different person." He said that you could actually see it in her whole face and her body language, everything. So this type of scenario also is something that really drives me to do what I do and why I love what I do.
So you mentor other dentists, right? You teach other dentists this type of dentistry.
Yes, I'm a mentor at a teaching center out in Seattle, and I work with other dentists of all different ages, and it's something that I really enjoy. So it's part of my CE junkie part because I learn
Continuing education.
Continuing education.
Nonstop.
Yeah, nonstop. And actually, during the teaching process, sometimes I'll learn more during that than I do going to a course. So
Is that right?
Yeah, because people ask questions and then it creates, I have to think about what the answer is and help them get to their answer. So
Now you brought some more for us. So what else?
I did. This is Andy. So he comes to me and says, "I need your help. I've got every problem under the sun." He says, "You probably haven't seen anything this bad." And that's pretty common. We get people that come in and say, "Doc, you've never seen teeth this bad." But the fact of the matter is that we see a lot of people like that. It's just that typically people that have bad teeth don't show them. They're not smiling.
Interesting.
And in some cases, that they may look more angry or just standoffish. So it's common.
So with him, what was going on?
Missing teeth, broken teeth, infected teeth, gum problems. So on top of that, the most important thing is that he wasn't able to eat anything that he wanted to eat, anything crunchy, hard, the foods that we enjoy. So let's give you the
All right,
here.
all right.
So for Andy, we did also another full mouth rehab. It was a combination of removing infected teeth, extractions, crowns, bridge work, building bone back for a couple implants, and that's the result. And now he's able to eat what he wants, and he's very, very pleased with his smile, even though that wasn't the primary reason was to eat. Now he's showing more confidence with his smile.
So they come in really oftentimes just because they want to get out of pain, and then it turns into a cosmetic thing like this.
Almost always, because pretty much everything in my mind is cosmetic. We always look, whether it's a back tooth, a front tooth, I treat it the same. It's cosmetic. I want to make it look like nature and make it look the best that it can. And I know that that's going to affect overall their life.
So you're a dentist. So you probably think that the smile is like the most important thing.
So Randy, dentist or no dentist, and you may take this for granted, because you do have nice teeth, and I think about it. So, but it's going on all the time, and if you look at any survey, and someone's looking in the dating, one of the top 3 things that comes up always is smile.
Like what they look for in somebody.
Absolutely.
Okay.
And it also brings confidence and charisma. In our culture, we define charisma with how you look, how you smile, and how you present yourself. And the smile is a big part of it. In fact, if you look at the presidential candidates, the ones that have been successful all have charisma. And if you look at them,
can smile.
They smile. On a job interview, let's say 2 twins come in, and one is smiling and one isn't, regardless of what the teeth look like. The one that smiles is going to present with more charisma and confidence, and is going to be the one typically that gets hired.
Yeah, that's true.
So what it boils down to is, if you're not happy with your smile, do something about it.
So are there really a lot of people where you are that hate their smiles?
There's tens of thousands of people that hate their smiles, and in fact, there's probably people where I go out to mentor that don't like their smile and maybe just appear grumpy, or maybe upset or angry, but what it really is that they're not comfortable smiling, but that's what shows if you're not smiling.
Okay, good. You brought more photos.
I sure did. Let me show you this next patient, Jessie.
All right.
She has an aged smile, and what she doesn't like about it is that her teeth are short, they're worn. Some of that has to do with the fact because she has some problems with the way her teeth fit together. When she came in the consultation, one of the questions I always ask, and I asked Jessie, I said, are we creating a smile that you used to have or one that you never had? Because they're 2 different things. And in her case, it was we wanted to create a smile that she used to have because her teeth have worn down and they're shortened, and there was some teeth breaking down. And in fact, she even did lose 1 tooth because of that. So her goals were to get back where she was.
What did you do?
So we did a combination of some crowns, some veneers. She did have 1 implant placed on that 1 tooth that was lost, and gave her back her smile and her confidence. And you can see it in the picture. Her eyes glow when she walks around. She looks different. You said that earlier in the green room that you could spot veneers.
I do. I feel like I could spot who has veneers and who doesn't.
Right. And in her case, this was not a smile that we created that was overpowering. We wanted to give her back what she had. And
that does look natural.
And that was our goal, to give her a natural smile.
So when I see people with these big bulky veneers, like on some of the housewife shows,
right,
is this what the patient wanted, or is this the dentist giving them big veneers? What's your take on that?
Randy, my take is people want natural, healthy-looking smiles.
Okay.
And I don't know whose fault it is, but in our practice, that's what we do. We give natural, healthy smiles.
Is there more art or more science to this?
It's a combination of both, but there definitely needs to be an artistic eye. So I want you to look at the after one more time. The teeth are not too long. They're age-appropriate in color. And we don't just slap these veneers on. We have to make sure that the teeth come together properly, otherwise it's not going to last. And one of the things that's important is this has to last as long as possible. So this is an example of somebody who we did do age-appropriate color, shape, size, and give her what she wanted. Once we finish with our treatment and people have their smile back, we give them a mirror and we have them look at it. And this is the fun part, when you see them light up and smile. And in fact, with her, she stood up and gave me a hug. And that's something that's common. I get hugs from patients. I've had 1 patient cry. So, tears of joy, essentially.
Do you ever get kind of choked up
Yeah.
I mean, if they're emotional about it, you can't help but.
Absolutely, because that's what we're about, is changing their life, and I know that we just accomplished that. When you see something like that, when a tear is running down or they're giving you a hug in a dental office, right? Because not many people like to come to the dental office, but when we get that result, it's amazing.
You say these people that before they even see you, they've hated their smile for sometimes 10, 20 years.
Absolutely.
Is that true?
It is true. It is true, and they just don't know where to go because they think that they're too far gone with their teeth, or they're embarrassed to come. I have people come in all the time that are embarrassed to show me their teeth, believe it or not, and some people are just so fearful, which is where the sedation part is such a big piece, because we make people comfortable, and we have a wide range of sedation options, but ultimately it's about making the person comfortable and leaving in that afternoon with a new smile. And
okay.
So let me show you. So she comes to me and asks and says, I need your help, doc. Yeah, I don't like the way my teeth look. I've been told I need this, I need that. She had 5 different opinions. We did a full mouth rehab on her, which included some gum contouring, crowns, veneers. She also did need some bone building and a couple implants as well where teeth were missing. And another person who left that afternoon ecstatic. When I gave her the mirror, got up and was life-changing, game changer. Here's another patient here.
All right.
Like it or not, in our culture, there is discrimination or stereotypes with people that have teeth that are not in good shape.
Bad teeth.
Bad teeth.
So what do you mean by that? They're discriminated against?
If you want to make someone look unintelligent, you might have them not have one tooth. You might take a tooth out. And
like in the movies,
in the
if
movie,
you wanted
exactly,
okay.
in the movies. If you want to make someone look maybe dishonest, maybe you'd give them the long veneers. Generally, otherwise in Hollywood, everyone else has good teeth. So it's really someone that is going to be villain or somebody who is going to be portrayed negative, and they give them bad teeth in Hollywood. And so that's the stereotype. And I think some people, like this patient here, we're dealing with that.
So she was missing a lot of teeth. She had some problems going on.
She had a
so
lot.
This is like the classic full mouth, as you call it, reconstruction?
This is a classic one, yeah. Missing teeth, broken teeth, infected teeth, and teeth in the wrong position. So we replaced her missing teeth with dental implants. We gave her smile back. When she left, this was another patient, mirror up, and huge smile. And we didn't have to teach her to smile. It came back. And with her, she's one that we gave oral sedation and some IV sedation. She was comfortable the entire time. And that's a big piece of it, is making sure that they're comfortable, because that's what was holding her back to begin with.
Not all dentists do sedation, right, during these procedures. And we talked, I told you, I said, maybe it's insane, because I use nitrous when I go in, even for a cleaning. It's relaxing.
Yeah.
And some dentists will say, well, we don't really need to use that. We make them comfortable. I almost think that's insensitive, because nobody likes going to the dentist for those reasons, the sounds and everything else. So if you could have sedation, and I'm not trying to endorse you, by the way.
Right.
But I want to know your opinion about this.
So my opinion is that whatever the patient needs to be comfortable, and it's just basically asking them, what are your fears, what's going on? If somebody is scared of the noise sometimes and they say, but I can deal with everything else, we might do night. I have one gentleman. All right. Yeah, he's a great guy. He says, if you give me some nitrous and some Jimmy Page, I can get through anything. And literally that was his treat. That's how we got him through. And he also, I've got a little secret sauce for my injections, and that's one of the compliments that a lot of
That's right. You were bragging about that people don't feel your numbing injections.
Yeah,
right?
and part of it is just being empathetic to the patient. So for him, it was nitrous, Jimmy Page, and a little bit of going slow and a little bit of a secret sauce. He hated his smile. He hated his smile. He had really dark teeth from medication when he was younger, and a couple broken down teeth, someone who grinds their teeth, and we essentially rehabbed his entire mouth. So, in fact, this is somebody that I did, his whole upper arch, his whole upper set of teeth is complete. So when we got finished with his treatment, he was smiling ear to ear, still listening to, Led Zeppelin.
Okay.
But, and the couple teeth that were really creating pain for him, that went away. He said, "Doc, I can eat now. Thank you so much." And I think that was, the smile part was huge for him as well, and the function part, because he's somebody that wants to be able to eat what he wants to eat. And when we got finished, he was able to do that. So here's a before picture of someone who most people would say has a nice smile, but she wasn't happy with it. And so she did
So when you look at this, what do you see that you can fix?
There's some small rotations in her teeth and some spacing, and the proportion of the teeth aren't exactly how they should be. So in one afternoon, that's what we did, and that we gave her 6 veneers. So some might call that instant orthodontics, but this was actually done very conservatively, and it's going to last a long time, and she was ecstatic with the result. So here's another patient, Randy.
All right.
This is another patient who has essentially a lot of problems, and she came to me and said, "I hate my smile."
They actually say that?
Yes, they do. This will people say it in different ways, but in this case, that's what she said.
All right.
And she was also told that she might need braces. She might need, 3 or 4 different opinions. So she came to us knowing that we kind of do everything under one roof. This is what we did.
Very nice.
Her smile looks bigger. If you look at her face, it's brighter. Her hair even looks different. In fact, she told me, I saw her last week. Thank you. This is 2 years ago. Maybe 2 or 3 years ago, and she said, "I can't tell you how many compliments I've gotten on my teeth." We did a combination of some veneers, some crowns, and managing how the teeth come together, because that was actually a big issue for her. And look at the before and after. The amount of detail that goes into
it has changed her appearance.
There's a lot that goes into making that, and if you see how the teeth follow the lip line, it's age appropriate, but they're light how she wanted. So Randy, here's a more dramatic case,
all right,
and I'm going to show you actually 2 befores. If you look at the teeth, you might not think that there's a lot of people.
That's got to be unusual, though, to see this, right?
It's unusual because most people don't smile when they have that scenario, when they have bad teeth like that, but it's not that unusual. We see that every day in our practice. So this is a guy that we had to rebuild his whole mouth. Okay. And so let me show you where we ended up. Look what this has done for his appearance. And in fact,
yeah, it's dramatic.
Back to our earlier statement, if you were interviewing these 2 guys, which one would you hire?
I mean, with all things being equal, at least the person smiling
correct.
over the one not smiling.
Yes, absolutely. Another patient that came in needed our help and basically needed a full mouth smile makeover. Got a little bit of everything to make that happen, implants, crowns, and that's where she is now.
Nice.
And take a look at that. I mean, it's huge. And she's somebody who the reason that she ended up that she was like that for years she's a high fear patient. So she came into us for the IV sedation part, and also knowing that she could get it all done under one roof.
Okay.
And so when we got there and got her to that point, now she's a different person. She's not even as nervous when she comes to see me. She still will get IV sedation for treatment, but she's a different person. So
good. We have time for one more.
Yeah, this one's special to me.
Okay.
Okay. That's Derek. If you notice, he doesn't really even show his top teeth. He has a hard time smiling there. He had excruciating pain in all of his teeth, so he came to us. Another high fear patient came for the sedation and to get everything done in one place. After we got finished, this is him getting married, and you can see, look, Randy, look at the teeth where he shows.
Yeah.
There was no teeth on the top, and the teeth were there, but he didn't show them because he couldn't smile. He didn't know how to smile.
What a difference!
And when you see here. And it's not just the teeth. Look at his eyes.
Yeah.
Look at how happy he is. So obviously it's his wedding.
So he must have sent you these photos.
He sent me a USB with about 30 photos on it, and
nice.
He said, "Yeah, I just wanted you to see these." And that's the same thing to me as like getting. I mean, he's not a guy that's going to hug me.
Right.
He's
right.
not. But that's the same thing to me as getting a hug, or because to say, "Here, take a look at all my wedding photos."
That is nice.
It was great.
We're out of time, but final message. Somebody watching this, right?
Yes.
Like you said, we're calling it full mouth reconstruction.
Correct.
If they have teeth that are loose or missing, gums are bad, their mouth's falling apart, but for some reason they're afraid of the dentist. They think they're too far gone. Or somebody that just hates their smile for whatever reason.
Never too far gone.
So what do you say to these people? Final message that are putting it off.
I say that you need to do it. If you're unhappy with what you have, do it as soon as you can, because you have more time to enjoy the benefits of that. And it's that ripple effect. It's going to change your life.
Because of their self-confidence.
Self-confidence, charisma, like we talked about. Do it as soon as you can.
Good, good. I want to thank you for coming on the show. Very interesting. And if they want to go to your website, they can learn more there.
Absolutely.
And they make an appointment, they get to see you?
Absolutely.
All right, good. Thanks.
All right.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.